Today's episode is one that you are not going to miss. I'm going to give you information that is going to help you understand yourself and therefore avoid disease in the future. The really true preventative care tool is understanding your constitution. That's right. There are 5 constitutions in East Asian medicine. These are archetypes that are going to give you insight about who you are, what your weaknesses are, what your strengths are, and why you might be prone to getting certain diseases. When you look at this through a biomedical paradigm, you're thinking genetic predisposition, what your mother and father might have had. That's why we get family history. But it's more than that. It is a very key tool to preventative care, and it helps you in regards to treatment. Not everybody will respond to the same medication the same way. And why is that? Because again, we have different constitutions, and understanding that not only helps you prevent disease, but it also helps you find the best treatment plan. Stick with me. This is But I Don't Like Needles. All right, so jumping into the 5 constitutions of East Asian medicine, we want to remember that it's based in 5-element theory, which means that the medicine is always related to these 5 elements of nature: fire, earth, metal, water, and wood. Those elements relate to our organs, they relate to our channels, they relate to times of day, to seasons, to foods, to flavors, to everything. Everything is related, everything is connected, and everything is related to nature, which are these 5 elements. And we are no different. So we come into this world with certain constitution: a fire, earth, metal, water, or wood constitution. Some would argue that there's a combination that can occur, and I would agree with that not everyone is 100% solely one constitution, that there might be a combination. And when you look at the theory of East Asian medicine, a lot of these channels, one gets backed up, it affects the next, or one is deficient and it affects the next. So there is oftentimes more than one channel related and involved. So that is definitely a possibility and something to consider. And not only that, but as we age, it is inevitable that we are going to eventually relate to what we would consider the kidney channel, which is always going to wane as we age. And we will talk about that. So let's start off right off the bat. We're going to start off first with the fire channel. The fire channel relates to obviously fire. Fire is very busy, obviously. It's very active. It's very young, we would say oftentimes. But when you hear these different descriptions, you'll know when we talk about them, that's me. This constitution is someone who has anxiety. Now, a lot of these different constitutions will have anxiety, but underneath of that, it's a little bit different. In addition to anxiety, there is sleep disorders, there's insomnia, there's heart palpitations. The part of the body that it relates to is the tongue. The tongue can sometimes have challenges. For example, there might be a stutter, there might be a tongue tie as a child when they come into the world, there might be a speech impediment. The shoulders is where the channel lies. So if there's deficiency in the heart, also small intestine, which is the partner to the heart, this person might stand with concave shoulders, where the shoulders fall forward and they're small in the front, in the chest area, and there's sort of a winging action that can happen in the scapula. The reverse of that, that's a deficiency in the heart, small intestine. If there's an excess, it can be the reverse, where the chest is extremely prominent and overly pronounced. And that's also really fascinating because the small intestine is where we absorb all of our food and nutrients, and it relates to the heart, and the heart is its partner in Chinese medicine. And we know now, and this medicine is known forever, it seems, that there is a direct relationship to our gut and our mental state. And the heart channel relates to a lot of mental health. So sometimes these children are born with VSD, ventricular septal defect, where there's a little hole or a little opening between the ventricles and the heart. It's pretty benign most of the time. It just sort of closes on its own. But those little things that are in our early childhood that we start to notice, it does paint a picture that there might be a heart channel constitution for this patient. It doesn't necessarily mean that this patient is going to have a heart attack by any means, but this patient, when they get overloaded or deficient, they're going to feel it in their heart channel, which might relate to anxiety. It could be sleep disorders. This patient also will sweat easily. The hands and feet specifically will have sweating. There will be laughter. Laughter is inappropriate laughter specifically. Are you that person, or do you know that person that when they kind of laugh and you're not sure why they're laughing, where you would think they'd be maybe upset or angry, or that they might be scared or nervous, where instead of having those emotions, they laugh or they giggle? So what should a heart constitution patient work on or focus on in regards to preventative care and health? Well, we would want to incorporate meditation for sure, mindfulness, gratitude. I would also encourage these patients to do a lot of creative endeavors. Physically, we're going to want to open the heart and open the chest. Foam rolling and pec stretches, making sure that our shoulders are not falling forward, collapsing, because in the shoulder area is where our lymphatic circulates. There's a lot of lymphatic within the axilla, which is in the armpit. And last thing we want to do is have all of that locked up and closed off, because it will affect our hormones. And then obviously that will again increase the emotional anxiety aspect and mental health aspect to this channel. There are herbs that may be helpful here. There are herbs for the sweating even that actually can help with that. There are herbs for sleep and for the palpitations. Individually, all these different herbs can help, and we can customize a formula that can address specifically whatever is affecting you. But thinking in the preventative world, the mindfulness and the gratitude, the creativity, the exercises and activities that are going to open the heart, open the chest, are going to be the most beneficial. Our second constitution is earth, and the earth constitution relates to the spleen channel. This is our worrier. This is the person that can get so worried about anything and everything that their stomachs get miscombobulated. They are bloated. They have gas. They're craving sweets because there's a disruption of digestion. They will be fatigued, low energy, because again, the digestion has been affected. They're not metabolizing the food and turning that into energy, or what we would call chi. And this patient can sometimes have weight gain because of that. They will be predisposed to digestive disorders such as leaky gut, diverticulosis, which is a weakness or an outpouching. It relates to muscle weakness and muscle fatigue. There might be loose stools because, again, they're just not able to consolidate and not able to digest and metabolize. There might be food in the stools, and there will be poor memory because, again, you need the food to be turned into energy in order for us to think clearly. The part of the body that you'll notice about this person when you see them is their mouth, their lips. It's just the first thing that you'll see. The other aspect of the metabolism struggle with this patient can also relate to cholesterol issues. So what we want to do for this patient is we want to be very mindful of the food that we eat. Cold, raw foods are not our friend for this patient. This patient should be eating warm foods. In East Asian medicine, we actually believe that everyone should be doing that, but this patient specifically will definitely notice a major improvement in their life when they drop off cold, raw foods, and they're eating more cooked foods, warm foods, foods that are not too sweet, and the reason why they're craving those sweets is because our body works on glucose. And if we're not getting that metabolism and our cells are not getting what it needs, it's going to crave a quick fix and it's going to crave sugar. And that is going to obviously cause more dietary issues and more digestive issues and more struggles. So what we want this patient to do is to focus on positive affirmations, because that is going to help us stay in a present mindset, not worrying about the future. Journaling is also useful and helpful. Acupuncture is extremely useful for this patient. We are going to help them get into this present moment. It helps to digest their food, increase metabolism. And there are herbs specifically that are very useful and beneficial. These are the ginseng category. Sachunsatong is a very basic herb formula that helps this patient with their digestion and their energy, and it will be very useful. If this patient is not addressed, it will prolong and become backed up into a damp constitution. And dampness is inflammation. And as most people have learned, inflammation is the crux, is the underbelly, is the problem that correlates to almost all diseases. And with that, we want to make sure that we are metabolizing our food and things are going where they need to go. Otherwise, think of it like a swamp. It doesn't drain, it doesn't absorb, it gets backed up, things fester. And when you have fluid backup, dampness accumulates, now you're going to have some infections and you're going to start having this festering that are going to cause backup and disease. So we want to make sure this patient is moving. Strength training is great because we're trying to get those muscles working. We want to strengthen this patient. We want to make sure our food is warm and cooked and in moderation. And we want a mindfulness with positive affirmation and gratitude to switch the little gear, switch that station crazy in our mind away from the worry and into the present moment and into the positive. Our third constitution is the lung channel. The lung channel, it relates to metal and it relates to our lungs. This channel also relates to grief and loss. This is an amazing situation that I've seen happen where if someone loses their partner, very soon thereafter, they might pass from pneumonia when you see two older patients. Grief will attack the lungs. Grief and loss, if not worked through, does stay dormant in the body and it attacks the lungs, the inability to breathe. On a side note, with that fear of the loss and grief is what will make this person want to control things so that they don't lose and they don't grieve. So this patient is a person that wants to learn to accept and have faith. This is where spirituality comes into play for this patient. Whether you believe in God, whether you believe in a higher power, whether you believe in the laws of attraction, yin and yang theory, understanding that there's a power that is beyond us and that we are taken care of. And if we do good, then good will circulate. This is a patient that when you look at them, the nose is usually the prominent aspect of this patient. The lung constitution tends to have a very keen sense of smell, but not only that, they have a keen sense of everything. They're highly sensitive people, HSPs. Oftentimes, these are the people that you'll find will have fibromyalgia. They're very in tune. Some people would say even empathic. They might be have sensory processing disorders as children. Their skin is pale, usually. They have a predisposition for skin disorders because of that. Be very careful in the sun and being burned. It relates to fluid metabolism. We want these patients to do some movement, and we also need them to sweat. We need cardio, and we need to use saunas to clean out the lung channel, clean out the pores. We move through fluids not only do we clear out toxins through our urine and our bowels, but we do through our skin. And that's what this patient needs to do. This is a person that if they do not clear out those toxins, it can affect the body, and they may be predisposed to autoimmune diseases where the liver may get overloaded and there's inflammation and the immune system will attack itself. So this patient, we want to avoid toxins and metals. Really want to do cleanses for that reason. Doing your saunas, doing your cardio to sweat. Sinus rinses are also important because it does relate to the lung channel, which also relates to our sinus cavities. So this person might have had a history of sinus infections as a child, reoccurrent. This is important to get rid of all of those viral pollutants and things that are going to irritate us by doing sinus rinses on a regular basis. Foods that are going to metabolize fluids are good for this patient. There's an entire list of those through East Asian medicine, but we're looking at the cabbages and the cruciferous vegetables and the mung bean sprouts and the bok choy and things that are going to metabolize a lot of the water weight. And herbs are extremely useful, of course, again, for this patient, because we're going to be giving them astragalus root, for example. These are herbs that are going to boost the immune system. And that is the key with this patient, is the preventative care. And one thing that I have not mentioned is that there's seasons for the different channels that they might have more struggles. So for the heart channel, they tend to have heat because it's a fire element. So summer is that time, and it can be more aggravated in the summer. For the spleen channel, that is late summer, and there's sometimes like a dampness that will come with that late summer. That's that channel, and that's a tough time for that constitution. And the fall is for the lung channel, of course. When do people go back to work, go back to school, trying to get everything in order, trying to get everything organized, and the weather shifts and respiratory infections occur. So we want to make sure that we are doing all of those preventative care and definitely getting our herbs and keeping our health up in that time of year. The next channel is the water channel. It is the kidney channel. It is what we were talking about at the beginning, which is related to our kidneys. Honestly, we have yin and yang. We have two. Unlike the other organs, we have two. We have the right and the left, and that's yin and yang. And that is the crux of the medicine, right? It's a balance of yin and yang. Once the kidneys have depleted, we are no longer here. And that goes even for biomedical. Once the kidneys go, you can have one, but once they're both gone, so are we. And the kidney channel, when you have a young person that comes into this world as a kidney constitution, this person is going to have slow growth. They might have issues with their teeth, with their bones. The part of the body that jumps out is the ears. Either they're very small or they're very large. Those are the kidney constitution. They tend to have reoccurring ear infections that can be pretty obstinate. And the emotional attachment to this is fear. When you think about, getting extremely frightened, we will urinate, right? That's related to the kidney channel. That's fear. Fear does that to the body, and it descends that way. And the crux in the underbelly of this constitution is fear. And the constant struggle is giving this person safety, security. And so whatever that means and however we need to do, that's where we want to look at. This patient will have back pain. Even children will. You'll look at a child and you'll see sometimes a bit of a sway back where it's a little deficient in the lower back. That's a sign early on that there's a little deficiency, that kidney deficiency. And later on in life, that's where it goes. It goes to the knee pain. It goes to the back pain. As we get older, our bones tend to soften. We have to make sure that we are taking herbs and doing food and doing supplements that are supporting bone health. We also will be doing more gentle weightlifting to support that bone health. I would also recommend doing swimming, which is really helpful for people that are having pain and they are having issues with their backs or their knees. Swimming is a low impact. It's also in water. It's extremely soothing. And yoga Another really nice, gentle, low impact exercise, and walking, of course, is really fantastic for this. In regards to herbs, there are a slew of fantastic formulas for kidney yin and kidney yang, and it really depends whether you are becoming more kidney yin deficient or more kidney yang deficient, depending on whether you're running more hot or more cold. There are a slew of symptoms that will direct us in that path, whether it's more yin deficiency, more yang deficiency, or whether it's both yin and yang deficiency, or even a qi deficiency. But the kidney channel does relate to weight issues, swelling, water retention as well, swelling of the feet. This is definitely where we don't want to mess around. We want to make sure that we're staying very active with our medical doctors. And then the very last constitution is the liver constitution, and that is wood element. This channel governs the eyes. This constitution, when you see them, the eyes are what are going to immediately jump out at you. You'll notice that first. They are highly functioning, highly energetic people. They're very determined, and they tend to be successful. They can be stubborn. They can be angry. The emotion that's attached to this is anger. The first thing that happens when something doesn't go their way, their first emotion isn't to be afraid or to worry or to be sad. It's to be angry. The key with this element is that it is the wood element, and it is strong. But as we know, it needs to be pliable in order to not break. Be like the willow tree, right? And the flexibility is what is really important for this constitution. Recognizing that the anger will cause harm, learning how to channel that anger. They need a lot of physical activity, a lot of cardio. We need to also stretch the body so that they can become more flexible. The body will mirror the brain, and the brain will affect the body. So people who are rigid of thought will be rigid of body, and people who are rigid of body will be rigid of thought. So we want to do lots of flexibility here and a lot of activity and keep ourselves moving and keep ourselves in a good positive direction. These patients will have diseases of the liver. So we have to be very mindful and careful not to be eating fatty, sugary, processed foods, and we need to avoid alcohol. They can have high blood pressure, and they can have arterial diseases. And one more thing to relate to the liver is acupuncture is a extremely useful tool for this patient. Number one, it does increase the lymphatic movement, and it helps the liver function. It helps the blood flow. It helps getting out of that fight or flight. It reduces anger and gets us into a relaxed state. So acupuncture is extremely useful and helpful. The herbs as well, there are herbs that reduce blood pressure. They are very effective, as well as reducing cholesterol. And you can do these with medications initially if you're already on a medication, and hopefully the goal can be to wean off of that or reduce those medications. If you are borderline, these herbs are phenomenal and can really be useful and avoid getting on a medication by doing the herbs that are going to anchor yang and help to metabolize the fats in the body, as well as herbs for relaxing the sinews, as they would say, or there are specific muscle relaxers in a way that are herbal that will help to calm and keep you more even keeled. So those are the 5 constitutions, and those are the suggestions, and maybe you can relate to yourself and you can say, that's me. I'm definitely more of that one, or I kind of have a combo of the two. If you need a little confirmation, definitely see your acupuncturist near you and get the acupuncture and the herbs as soon as possible to help your health in the future. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.